Mental health disorders. This information is found in Chapter 52 of your textbook. Mental health involves a person's emotional, psychological, and social well-being. It affects how a person thinks, feels, and acts when coping with life, handling stress, relating to others, and making choices. Stress is a response or change in the body caused by any emotional, psychological, physical, social, or economic factor. Mental health is a part of everyone, something to look after, real and complex, very important, and something you can change. Mental health isn't a sign of weakness, all in one's head, something someone can just snap out of, always a negative thing, or something to be ashamed of. A mental health disorder is a serious illness that can affect a person's thinking, mood, behavior, and ability to relate to others. Mental health disorders are also called mental illnesses or psychiatric disorders. Here are some early warning signs of mental health disorders: eating or sleeping too much or too little, pulling away from people or activities, little or no energy, feeling numb like nothing matters, severe mood swings, persistent intrusive thoughts, thoughts of self-harm, unexplained aches and pains, feeling helpless or hopeless, substance abuse, feeling unusually confused or forgetful, yelling or fighting with family or friends, hearing voices, and an inability to perform daily tasks. Here are some risk factors for mental health disorders: genetics, life experiences such as history of trauma or abuse, chemical imbalances in the brain, TBI or traumatic brain injury, fetal exposure to viruses, substance abuse, and having few friends. Anxiety is a feeling of worry or nervousness. It is fear of an event or situation. Some anxiety is a normal reaction to stress. A stressor is an event or factor that causes stress. Anxiety disorders occur when anxiety cannot be controlled and it interferes with daily life. Coping and defense mechanisms may help relieve anxiety. Defense mechanisms are unconscious reactions that block unpleasant or threatening feelings. The various types of defense mechanisms will be discussed on an upcoming slide. There are several types of anxiety disorders. First, generalized anxiety disorder occurs when a person has extreme anxiety, fear, or worry on most days for at least 6 months. A panic disorder is sudden, recurring periods of panic when there is no real danger. Panic is an intense and sudden feeling of fear, anxiety, or dread. With obsessive compulsive disorder, the person has frequent, upsetting, and unwanted thoughts or ideas controlled by repeating certain acts. The person with OCD has frequent upsetting and unwanted thoughts, ideas, or images, known as obsessions. To control the obsessions and resulting anxiety, the person has an overwhelming urge to repeat certain rituals, acts, or behaviors, which are compulsions. Phobias are an intense fear of something when there is no real danger. Post-traumatic stress disorder occurs in some people after a terrifying, traumatic, scary, or dangerous event. With PTSD, flashbacks are common. A flashback is reliving the trauma over and over in thoughts during the day and in nightmares during sleep. There are a variety of defense mechanisms that help individuals cope with anxiety. The first one is compensation. With compensation, a weakness is replaced with a strength. For instance, if someone is not good in sports, they will develop another talent. Conversion is when an emotion is changed into a physical symptom. So for instance, a child doesn't want to read out loud in school, so they complain of a headache. Denial is when the person refuses to accept unpleasant or threatening things. For instance, after a heart attack, the person continues to smoke. Repression is when unwanted, unpleasant, painful thoughts or experiences are kept from the conscious mind. They can't be recalled or remembered. So for instance, a child was abused but does not remember the events as an adult. With displacement, behaviors or emotions are moved from one person, place, or thing to a safe person, place, or thing. So for instance, if you're angry at your boss, you might yell at your friend. Identification is when a person assumes the ideas, behaviors, and traits of another person. So a neighbor is a basketball player, and a child sees that, so they practice basketball in their backyard. Projection is when another person or object is blamed for unacceptable behaviors, emotions, ideas, or wishes. So for instance, after oversleeping, an individual blames traffic for being late for work. Rationalization is when an acceptable reason, but not the real reason, is given for behaviors or actions. So for example, a student does not turn in an assignment and does not get a good grade and thinks the teacher does not like him or her. Reaction formation is when a person acts in a way opposite to how he or she truly feels. A worker doesn't like his or her boss, but then gives the boss a gift. Regression is when the person retreats or moves back to an earlier time or condition. A 3-year-old wants a baby bottle when a new baby arrives. Sublimation is the refocusing of unacceptable impulses, thoughts, and emotions into more acceptable ones. Dissociation is the detachment from reality and from oneself, and the finding of another representation of self to deal with extreme conflict. It's an avoidance coping mechanism. And finally, intellectualization is overthinking and the misdirection of focus when confronted with unacceptable situations or behaviors. Psychosis is a state of severe mental impairment. It is what occurs when people are experiencing and perceiving the world around them differently from others. Psychotic disorders cause abnormal thinking and perceptions. In a psychotic state, a person has lost touch with what is real. The two main symptoms of psychosis are delusions and hallucinations. Delusions are false beliefs. Hallucinations are seeing, hearing, smelling, feeling, or tasting something that is not real. Schizophrenia is a serious brain illness which affects how a person feels, thinks, and behaves. The person may have delusions, thought disorders, movement disorders, and emotional, behavioral, and/or cognitive problems. The person with schizophrenia may have hallucinations and delusions that include delusions of grandeur and delusions of persecution. Delusions of grandeur are exaggerated beliefs about one's importance, fame, wealth, power, or talents. So for instance, a person might believe that they are a movie star. Delusions of persecution are false beliefs that one is being mistreated, abused, or harassed. With thought disorders, the person has trouble organizing or logically connecting thoughts. Speech may be garbled and hard to understand. Some people may make up words. With movement disorders, individuals have agitated body movements, repeating motions over and over, or sitting for hours without moving or speaking. Emotional and behavioral problems are seen as dull voice, no facial expression, have trouble being happy, have trouble planning and staying with that activity, and withdrawing socially. With cognitive problems, the person may have trouble paying attention or understanding information. The symptoms of schizophrenia are often characterized as positive, negative, or cognitive. So positive symptoms, it's the development of a behavior or thought pattern that isn't usually present, so hallucinations or delusions. With negative symptoms, that refers to the loss of a normal function, and that may come out as blunted emotion. And then with cognitive symptoms, the person's ability to think clearly attention, or memory is affected. So this chart just shows some pictures that show the differences between psychosis and schizophrenia. So psychosis is an episode where one is detached from reality. It can be a symptom of sleep deprivation, substance use, mental illness, and other conditions. Signs of psychosis include hallucination, delusions, agitation, and disorganized thought and behavior. Schizophrenia, on the other hand, is a mental illness that impacts thought processes, emotions, and behavior. To be diagnosed with schizophrenia, an individual must experience at least 2 of the following symptoms for 6 months, including one of the first 3. So they must have delusions, hallucinations, disorganized speech, catatonic behavior, or negative symptoms, such as the blunted emotion. Mood disorders occur when a person's general emotional state or mood is distorted or inconsistent with a situation and interferes with his or her ability to perform daily functions. Bipolar disorder is a type of mood disorder. With bipolar disorder, individuals experience severe extremes in mood, energy, and function. They have emotional highs or mania and emotional lows or depression. Depression is a mood disorder with distressing symptoms that affect thinking and daily activities. With major depression, symptoms are present most of the day and almost every day for at least 2 weeks. The symptoms interfere with work, sleep, studying, eating, and enjoying life. Major depression can occur just once or several times over a person's lifetime. Persistent depressive disorder, the symptoms last for at least 2 years. A person may have major depression in periods when symptoms are less severe. With persistent depressive disorder, symptoms are chronic and long-lasting. With seasonal affective disorder, it's depression related to changes in the seasons. It typically begins and ends at the same time each year. And then another type of mood disorder is disruptive mood regulation disorder. And that is a condition that is characterized by extreme anger, irritability, and frequent temper outbursts. Personality refers to the set of attitudes, values, behaviors, and traits of a person. The development of personality starts at birth. Influencing factors include genes, growth and development, environment, parenting, and social experiences. People with healthy personalities can cope with normal stressors. They are able to form relationships with family, friends, and coworkers. Personality disorders involve long-term patterns of thoughts or behaviors that are unhealthy and rigid. The thoughts and behaviors keep people from functioning in society. The first type is antisocial personality disorder. With this, the person has a long-term pattern of manipulating, exploiting, or violating the rights and safety of others. Behavior is often criminal. For instance, setting fires and animal cruelty during childhood are often seen. Symptoms include being witty and charming, flattering and manipulating others for personal gain or pleasure, breaking the law repeatedly, having no regard for the safety of self and others, having problems with substance abuse, showing no guilt or remorse, being angry, and feeling superior or more important than others. Borderline personality disorder is another type of personality disorder. With this, a person has a long-term pattern of unstable moods, behaviors, and emotions. Stormy relationships and impulsive actions often result. Symptoms include rapidly changing interests, shifting and changing feelings about other people, having an intense fear of being abandoned, being unable to stand being alone, feeling empty or bored, inappropriate anger, and impulsive substance use or sexual relationships, self-injury, and suicide. Next is dissociative identity disorder. With this, a person has 2 or more distinct personalities. The personalities control the person's behavior at different times. Finally, we have narcissistic personality disorder. This is a disorder in which people have an inflated sense of their own importance, a deep need for attention, troubled relationships, and a lack of empathy for others. Substance use disorders occur when the use of alcohol or other substances leads to health issues or problems at work, home, or school. It includes both legal and illegal substances. Opioids are drugs that are strong painkillers that cause drowsiness. Some cause an intense feeling of well-being, happiness, excitement, and joy. Stimulants stimulate the brain and the nervous system. Depressants depress the nervous system, causing drowsiness and reduced anxiety. Alcohol is an example of a depressant. Hallucinogens are drugs that cause sensations and images that are not real. LSD is an example of a hallucinogen. Marijuana affects the brain, causing a high. Seeing bright colors and mood changes are common. Addiction is a chronic disease involving substance-seeking behaviors with use that is compulsive and hard to control despite harmful effects. Drug addiction is a strong urge or craving to use substances. The person cannot stop using the drug. Tolerance develops, which means that they need more of the drug for the same effect. Alcoholism is alcohol dependence that involves a craving or strong need to drink, loss of control, not being able to stop drinking once started, physical dependence, withdrawal symptoms, and tolerance, which is the need for more alcohol for the same effect. Withdrawal syndrome is the physical and mental response after stopping or severely reducing use of a substance that was used regularly. Detoxification is the process of removing a toxic substance from the body. The CWA assessment is what is used in the hospital when a patient is withdrawing from alcohol. The COWS assessment is what is used in the hospital when a patient is withdrawing from opioids. Substance use disorder is not easy to treat. There are medications that can assist individuals who are suffering from substance use disorders. Eating disorders are a severe disturbance in eating behaviors with thoughts and emotions related to eating. Anorexia is when the person has an intense fear of gaining weight. The person eats small amounts and only certain foods are eaten. Bulimia is binge eating followed by forced vomiting and intense exercise. With binge eating disorder, the person often eats large amounts of food. Binge eating is not followed by purging, fasting, or exercise. The word suicide means to end one's life on purpose. A suicidal ideation is thinking about or planning suicide. Suicide contagion is exposure to suicide or suicidal behaviors within one's family or peer group or through media reports of suicide. If a person you are caring for threatens suicide, you should stay with the person and immediately call the nurse. The CNA's role in managing mental health disorders. First, the CNA should follow the care plan. The CNA should be alert to nonverbal communication, both the CNA and the patient. They should be alert for items that can be used as weapons. If needed, call for help, keep a safe distance between the CNA and the patient, and be aware of your surroundings. Do not let the patient block the door. When working with a patient with a mental health disorder, the CNA should greet the client when he or she enters the room, encourage self-care as appropriate, encourage independence with ADLs and activities, allow the client to make choices as appropriate, and it's important for the CNA not to take the client's behavior personally. The CNA should also stop when the client resists what you are doing. It's important when working with patients, both with mental health disorders and without, to monitor your body language. Do not yell or argue with the client. Use silence appropriately. Be respectful of the resident. Provide privacy as appropriate. Review reality with the resident. And answer questions about time, place, and people honestly.